so the next part of Unit 1 is on anatomic definitions. You see the reference to the instructional guidelines from the National Educational Standard. If you care to look that up, please feel free to do so. Y'all need some of the lights turned off, or can y'all see all right?
It's more funny than it was before. So
Okay. All right. Better?
Better.
All right. Yes. I've always wanted to be an optometrist.
Better, worse.
Better, worse.
Number 1, number 2.
All right. This unit is taken from Chapter 1 of your AAOS Anatomy and Physiology for Paramedics textbook. It's easy to spot. It's the one with the dirty pictures on the cover. The objectives, our learning objectives today are to define the terms anatomy, physiology, pathophysiology, and homeostasis. We're also going to attempt to define the anatomic position, sagittal, mid-sagittal, transverse, and frontal planes. We're going to use proper terminology to describe the location of body parts with respect to one another. Anatomic position. One thing, there's different kinds of anatomy. What we're talking about today is, for the most part, topographic anatomy. Means we're going to use terms that describe the position and movement of the body. Some of them are relative terms, meaning that they're terms that we use to describe a position on the body relative to other parts of the body. Some of them are not, so some of them are universal. The anatomic position is an example of a term we use that's not relative to other parts of the body. It's the universal position from which all body positions and movements are described. The anatomic position is this. It's a man standing with his thumbs pointed out, palms facing forward. Same way, man or a woman. Thank you for that lesson in political correctness. The subject stands upright, facing the observer with arms straight and palms forward. Now, we have several terms here. Notice, first off, that right and left always refers to the patient's right and left, which is a mistake, believe it or not, that is probably the most common in the field. I see things misdocumented all the time. IV, left AC, when it's in the right AC, because they're facing the patient when they started the IV. All right, so you always have to describe things from the terms of the patient's perspective with reference right or left. If we draw an invisible line right down the middle, anything away from that midline towards the edges is lateral. Anything towards the torso is proximal. Anything away from the torso is distal. Anything towards the head is superior. Anything towards the feet is inferior. We've got a couple of other terms that we're going to use for that too. These directional terms always pertain to the patient's right or left. There are several anatomical planes. There's the frontal, also known as the coronal plane, which divides the body into the front and back parts. The front part is the anterior or ventral. It's situated towards the front of the body, so the front half of me is anterior. The back half is posterior or dorsal. The way that I keep ventral and dorsal separated in my mind is to think about the dorsal fin on a shark. It's on its back. Dorsal is back, ventral is front. The transverse or cross-horizontal plane divides the body into the cranial and caudate parts. The cranial, also known as the cephalad or superior, refers to a structure that is closer to the head or higher than another structure, and the caudate or inferior refers to a structure that is closer to the feet or lower than another structure. So cranial, cephalad, and superior all mean the same thing with reference to anatomical position, and caudate and inferior mean the same thing. So you might want to take some time to commit cephalad and caudate to memory so as you don't get them confused. The median or mid-sagittal plane is the midline. It passes longitudinally from front to back through the middle of the body and divides the body into the left and right halves. Medial is situated towards the midline of a structural organ, and lateral is situated away from the midline of a structural organ. The sagittal plane is the vertical plane parallel to the median plane, dividing the body into unequal left and right parts. We usually don't use anything other than the mid-sagittal line or the midline, but there is, for example, you could say that a sagittal plane runs through the right midclavicular point. So this becomes more relevant really in the hospital setting for diagnostic tests.
Sagittal plane is just off center.
There you go. Yeah.
Midclavicular.
Right. The sagittal plane that's labeled here is actually running through the mid-sagittal. It would be a mid-sagittal plane. Notice that the frontal plane divides anterior from posterior, and the transverse plane divides inferior from superior. Transverse planes are used in a lot of medical testing. In particular, they're used in CAT scans. The radiologist or the doctor can see all of your internal structures in infinitesimal transverse planes to be able to diagnose different problems.
The sagittal plane can be midline.
The mid-sagittal plane is always midline. Plane, the mid-sagittal plane is a type of sagittal plane. It's a subset of a sagittal plane. So a sagittal plane can be midline or other places. Don't get hung up on that. When we say sagittal plane, we almost always mean the mid-sagittal plane. Proximal and distal. Proximal is nearer to or towards the trunk of the body. Distal is farther from the trunk and towards the free end of an extremity. So I can say that my elbow is proximal to my wrist. Or conversely, I can say my wrist is distal to my elbow. Imaginary lines. There's the mid-axillary line, which is the vertical line drawn through the axilla to the wrist. What's your axilla? To the waist, I'm sorry. Ugh. It's the vertical line drawn through the axilla to the waist. The anterior axillary line is parallel line drawn just an inch or so in front of the mid-axillary line. The posterior axillary line is parallel line drawn an inch or so behind the mid-axillary line. Anterior and posterior axillary line, don't worry about those so much. We're really talking about the mid-axillary line, which runs right up here through your armpit. Okay? So, for example, if I have a patient that's shot right here, which is not an uncommon place to be shot, by the way, you would report to the receiving hospital or to TCC that you have a patient with a gunshot wound at the left mid-axillary line. Right? Tells them a lot. That's a very damaging wound. Usually it involves both lungs, and that's why it's usually a pretty bad place to get shot.
What did you say, the axilla?
Mid-axillary line. Axilla is your armpit. Some other imaginary lines that we use a lot are the mid-clavicular lines. We use that as an anatomic landmark for a bunch of procedures, including placement of 12-lead EKG electrodes. The mid-clavicular line is the vertical line through the middle portion of the clavicle and parallel to the midline. Your clavicle is your collarbone. It usually corresponds to the patient's nipples. But nipples is a very relative term, you'll find out. Everybody's nipples aren't in the same place. Abdominal quadrants. You should all be familiar with this. If we draw both a vertical and a horizontal line that intersect at the umbilicus or the navel, you should commit to memory what organs are in which abdominal quadrant. For example, the liver is primarily in the right upper quadrant. The spleen is primarily in the left upper quadrant. The appendix is primarily in the right lower quadrant. The those are the things that you should commit to memory. The stomach is primarily in the left upper quadrant. Abdominal quadrants, what are the purposes of having these boundaries? Well, because their specific organs are located in each of the 4 quadrants. Pain or injury can be described as being in a quadrant, so it's mostly for documentation purposes, passing information from one provider to the next. You can document your findings by quadrant, and everybody understands what you're talking about. It's a standardization of terms.